All right, Chapter 32, drugs used to treat gastroesophageal reflux and peptic ulcer disease. This is on page 492 in your book. So the primary function of the stomach is the storing of the food, the mixing of the food with gastric secretions, digesting it partially into chyme, and passing it on. It slows the rate of emptying of the stomach to allow for proper digestion and absorption of the nutrients in the small intestines. There are three types of secretory cells in the stomach. They include the parietal cells, which secrete hydrochloric acid, which is necessary for the optimal pH of the stomach. It also, they contain H2 or histamine 2 receptors in the parietal cells, and these stimulate the secretion, which stimulate the secretion of hydrochloric acid. So think about your H2 blockers we're going to talk about. This is where Zantac is effective in reducing acid. Parietal cells also secrete the intrinsic factor needed for the absorption of vitamin B12. We know that patients who are deficient in this intrinsic factor have a condition called pernicious anemia. So they lack that intrinsic factor to absorb the B12, and that's why we give the B12 injections. They also have mucus cells, which secrete mucus, which protects the stomach wall from injury due to acids and enzymes. Sheath cells secrete pepsin. We know pepsin aids in digestion, and the stomach lining also produces a prostaglandin, which prevents injury by inhibiting gastric acid secretion, maintains blood flow, and stimulates mucus and bicarb production. So here you want to think about your ibuprofen or your NSAIDs, which inhibit the prostaglandin secretion. So if we're inhibiting the prostaglandin secretion, then we're increasing the risk for the lining of our stomach. So that is why ibuprofen, Motrin, NSAIDs can be irritating to the lining of the stomach. Common stomach disorders. We are going to talk about GERD, or gastroesophageal reflux disorder, also known as heartburn. This is when the gastric contents pass back through the sphincter into the esophagus, irritating the lining. This is a common disorder. It affects 5 to 7% of the population in the U.S. Symptoms include burning, regurgitation. GERD is caused by a weakening of the lower esophageal sphincter, delayed gastric emptying. It can be caused by hiatal hernias, obesity, overeating, or increase in acid secretion. So think about ways to prevent it. So increasing acid secretion, there are certain things that increase our acid. These are smoking, alcohol, carbonated beverages, coffee, and spicy foods. So patients with GERD, you want to encourage smoking cessation, decrease in alcohol, decrease in carbonated beverages, decrease in their coffee intake, and a more bland diet. The other condition we'll be talking about is peptic ulcer disease. This is referred to as acid indigestion. Peptic ulcer disease refers to several stomach disorders. This is a result of an imbalance between the acid in the stomach and the body's defense barriers. This imbalance results in ulcers in the stomach. So if you have increase in acid or a decrease in your defense barriers, you're going to be at risk for an ulcer. So the other thing to keep in mind when treating these disorders is that you always, the presentation of peptic ulcer, GERD, reflux, heartburn can also represent cardiac disease. So you always want to rule out any cardiac disease prior to treating your gastrointestinal disorders. The goal of treatment of GERD is to reduce the frequency and the duration. You want to heal any tissue injury and prevent reoccurrence. The most effective treatment is lifestyle modifications. These include weight loss, avoiding smoking, alcohol, spicy foods, and eating smaller meals. You also want to limit their use of NSAIDs, remember the prostaglandins, and switch them to Tylenol if possible. Medications possibly used here include your H2 blockers, your proton pump inhibitors, and anticholinergic agents, antacids, carafate. And if they have a condition called H. pylori, we know this is caused by a bacteria, so they would be put on an antibacterial such as amoxicillin and a proton pump inhibitor. What percent of the U.S. population suffers from gastroesophageal reflux disease on a daily basis? So the answer here is C, 5 to 7%. Antacids on page 497 in your book. Table 32.1, you will see a list of the antacids. Antacids lower the acidity of the gastric secretions by buffering the hydrochloric acid. So your normal pH in your stomach is 1 to 2. So buffering the acid is going to increase your pH, which reduces the action of the pepsin, which remember aids in digestion, and gastric juices, and it buffers the acid to a level of 3 to 4. So this decreases the corrosive ability of the pepsin in the gastric juices, which decrease the irritation and ulcer formation. So antacids are also used to treat heartburn related to excessive eating and drinking. You want to encourage your patients not to use antacids for more than 2 weeks before contacting a physician in case this is not related to the GI system. You do not want some cardiac underlying disease not being addressed. So the common ones that you will see in practice, the common antacids, are your Tums and your Maalox. So keep in mind that some antacids are based on calcium or aluminum, and some are magnesium based. So your calcium based antacids can cause constipation, and your magnesium based antacids can cause diarrhea. So those are the two big side effects of antacids. A patient reports severe abdominal pain that occurs approximately 45 to 60 minutes after eating. The patient notes that eating dairy products or drinking milk alleviates the pain, but eating Mexican food or drinking alcohol worsens the condition. The healthcare provider orders x-rays to be done in several days, but in the meantime, which type of drug will likely be recommended? So the correct answer is C, antacids. Think about spicy foods. Alcohol is causing an increase in pain. So we know that this is probably related to either peptic ulcer disease or gastroesophageal reflux. So an antacid is advised for this patient whose symptoms indicate probable peptic ulcer disease or GERD. What is a common adverse effect of aluminum-based antacids, especially when consumed in large quantity? So think aluminum, calcium-based is going to cause, correct, B, constipation. Okay. Histamine 2 receptor antagonists. On page 498 in your book, table 32.2, you will see a table listing your common H2 antagonists. So histamine 2 receptors stimulate the release of hydrochloric acid. So histamine 2 receptors stimulate the release of hydrochloric acid. This is going to increase the acid in your stomach. So by blocking the H2 receptors, you're going to reduce the release of this acid, which is going to increase the pH in the stomach, and is going to help heal any ulcers or reflux disorders that have caused irritation. So the commonly used H2 blockers that you will see are your ranitidine, also known as Zantac. You will also see quinidine, which is also known as your Tagamet, and famotidine, also known as Pepcid. And again, these are all on page 498 in your book. Those are the three common ones you'll see. Keep in mind that these are metabolized through the liver. So you want to think about hepatotoxicity with these. The tagament specifically can cause gynecomastia in patients. So patients who have long-term treatment with tagament, you want to just watch for that. And on page 498 to 499, it lists the drug interactions, which is actually quite extensive. So just take a peek at that. Prostaglandin, gastrointestinal prostaglandins, this includes your cytotec. This is on page 499 in your book. So prostaglandins inhibit hydrochloric acid and pepsin secretion, which protects the, as a result, protects the stomach and duodenal lining. So the most common contraindication is pregnancy, because we know that cytotec actually induces labor. So we do not give cytotec to anybody who is pregnant, because we will induce labor. Proton pump inhibitors on page 501 in your book. In table 32.3, you will see a list of the PPIs. Proton pump inhibitors inhibit the secretion of gastric acid through the hydrogen ion pump in the stomach's parietal cells. So remember, the parietal cells in the stomach release the hydrochloric acid. So we are inhibiting the release of the hydrochloric acid through the proton pump and receptors. So these are used to treat ulcers and reflux. Your common side adverse effects are diarrhea, headache, fatigue, and muscle pain. And your serious adverse effects are rash, risk for fractures, and low magnesium. So the common ones you'll see, again, looking at page 501, Protonix or pantoprazole, omeprazole, also known as Prilosec, and Prevacid, lansoprazole, so those are the, Nexium, that's another kind of biggie you'll see. I would study particularly Protonix, Prilosec, but all four of these, Nexium, Protonix, Prilosec, Prevacid, you probably will see in your practice, so there's four that you kind of want to get familiar with. And on the, if you see these on the exam, you'll see both the generic and the brand names, so you can kind of just study both of those. The nurse is teaching a patient about the use of prescribed proton pump inhibitors to decrease the symptoms of GERD. Which statement made by the patient indicates a need for further teaching? This medication will coat my stomach so it doesn't hurt so much. B, this medication will lower the amount of acid in my stomach. C, if I develop a rash, I'll let my healthcare provider know right away. Or D, I'll make sure I drink plenty of fluids. So look at the question. The question is asking which statement by the patient indicates a need for further teaching. So which one is incorrect? So if you think about the mechanism of action of proton pump inhibitors, they inhibit the gastric secretion of the hydrochloric acid. So the incorrect statement, or the correct answer, is this medication will coat my stomach so it doesn't hurt so much, because that's not what this medication does. Proton pump inhibitors do not coat the stomach. They inhibit gastric secretion by inhibiting the gastric acid pump of the stomach's parietal cells. Therefore, they reduce excess gastric acid. You remember, rash is an adverse effect and should be reported to the physician. And plenty of fluids is actually something we want our patients to do. So on page 502 in your book, it talks about Carafate or Sucralfate. This medication adheres to ulcers, protecting them from acid, pepsin, and bile. So it actually coats the stomach. It does not alter the hydrochloric acid or the pepsin, but it coats the stomach. It's used for duodenal ulcers, particularly useful for patients who do not tolerate other forms of therapy. Things to keep in mind is that it can cause constipation, dry mouth, dizziness. So again, that's your caraphate. Page 502. So prokinetic agents on page 502 as well. This is your Reglan or your metoclopramide. So Reglan increases gastric emptying and reduces reflux by increasing the lower esophageal sphincter pressure. It increases stomach contractions and it relaxes the pyloric sphincter, as well as increasing peristalsis. So we are increasing the gastric emptying of the stomach. We're kind of helping that food move along more quickly, aiding in digestion. So this is used to treat reflux, gastroparesis, and then also can be used as an antiemetic. The biggest thing with Reglan is to watch for the extrapyramidal symptoms such as restlessness, involuntary movements, facial grimacing. That is an adverse effect that happens in 1 in 500 patients, so it's fairly common, and you just want to educate your patients that this is a possibility. So again, your prokinetic agent Reglan or metoclopramide is used to kind of move things along in the gut. The nurse is teaching a patient about metoclopramide or Reglan therapy. Which patient statement indicates to the nurse that the patient has a correct understanding of therapy? A. This drug will slow down the acid being produced in my stomach. B. By coating my stomach, this medication will reduce my stomach upset. C. This medication will make my digestive system move faster. Or D. I'll be able to return to my job as a truck driver tomorrow. So looking at what the question is asking, it's asking you the mechanism of action of Reglan. This drug will slow down the acid. No, it does not affect the acid. By coating my stomach, no, it does not coat your stomach. So A is incorrect, B is incorrect. C, this medication will make my digestive system move faster. Yes, that is true. So we'll keep that in. And then D, I'll be able to return to my job as a truck driver tomorrow. That has no significance whatsoever, so we know that's automatically out. So the correct answer is C. This medication will make my digestive system move faster. Antispasmodic agents on page 505 in table 32.4. This reviews the antispasmodics, which are anticholinergics. So this is mostly you're going to see used the bentyl. Oops, sorry. Dicloclamine is the generic. So this is used to treat irritable bowel syndrome, biliary spasm, mild ulcerative colitis, pancreatitis. It can treat colic in infants and peptic ulcer disease. So think about your cholinergic receptors. We know that the parasympathetic innervates the GI system. Remember, your parasympathetic is your rest and digest. So parasympathetic and your cholinergic receptors promote digestion. So if we are inhibiting our cholinergic receptors, we're reducing the cholinergic effects in the GI tract. This means we're inhibiting GI motility, we're inhibiting GI secretions. So think about irritable bowel syndrome. The bowel is irritated, it's overactive, so we want to reduce that. So by administering an antispasmodic or anticholinergic bentyl, we are decreasing the GI motility and the GI secretions and the overactivity. Adverse effects can include constipation, right? Think about anticholinergics. What do they cause? So they can cause constipation, urinary retention, they dry you out, right? They can cause orthostatic hypotension, confusion, and some dysrhythmias.